I remember the first day as a doctor very well. It was so scary. Everything is brand new for you and you are expecting some sort of ceremony when you walk through the ward. No one really factors in you are a brand new doctor and it is your very first day. Just straight to work. I trained to be a great doctor, but the sad reality is lack of resources limit the decision you take. I had no idea how challenging it was going to be. University tries its best to prepare you for the transition between medical student and being a doctor. But I think the only way you possibly get into that position is by experiencing it. Seeing a patient die for the first time had a huge effect on me. It was a patient I had gotten to know well. I had just left the ward for a second and go and have a cry in the washroom. I felt so helpless and so out of control. But I had to go back onto the ward, hide any emotion and move on to my next patient. But I remember this playing on my mind all day. I was so angry that we couldn't do anything for the patient and we had let him down. The society had let him down. I couldn't let it go and I needed to tell the world. I remember thinking that how could I let something like this happen? And someone needed to be accountable. Eventually, I spoke to a colleague and friend who advised me get in touch with medical protection. I hadn't even considered that as an issue they could help with. When I call them, it's a great comfort to know I was speaking to a medical legal consultant who had themselves also worked in the public sector. They advised me to talk with my supervisor first, and this allowed me to open up to someone about some of the issues I was feeling and find some sort of internal resolution. It's great to hear some stories from my supervisor about her own experiences as a resident doctor and allowed me to feel like I was not alone in all this. Medical protection also gave me the details for the confidential counseling line. It was evident that I was under a considerable amount of stress at work and it's having a huge impact on decision making. Being a doctor is a big responsibility and you always have to be thinking about that. But sometimes you forget about it and you're carrying on your life. Suddenly you have a week or hits you, but you kind of deal with it. What I have learned in all these is so important to talk to someone. I didn't really see the relevance of medical protection when I was a medical student. I wasn't sure they aimed at my level. But now, knowing that I have somewhere to go when things do get hard is a great comfort.